Dr. Ibe, once again, welcome back. Is it all the time that somebody has a high cholesterol that they have to be on medication? Well, the answer to that is really no, not all the time that somebody has a high cholesterol that they have to be on medication. Before I explain that further, let me say that when we request for cholesterol, we do what is called the lipid profile, which means we look into the total cholesterol, the triglyceride, which is a bad cholesterol, the LDL, low density lipoprotein, which is a bad cholesterol, the HDL, which is a good cholesterol. HDL means high density lipoprotein, and then the ratio between the total cholesterol and the HDL. We do all these parameters, and we equally look into the family history of the person, the age of the person. I've mentioned to us about the body mass index, the height and weight, and smoking habit and drinking habit. We put all this into a context, into a parameter. If the person's percentage is more than 20, the person's risk of having an event is more than 20% in the next 10 years, then we can put them on medication, on a statin, to reduce the risk factor, to reduce the risk of having that event. If it is lower than 20, if it's around 10, 11 or whatever, lower than that, we then advise on lifestyle changes, which means increased exercise, losing weight, stopping smoking or drinking, and refraining from a sedentary lifestyle. And this is advised for a long period of time. However, we repeat the test within the next 3 to 6 months. And most times, the lipid profile, the cholesterol, comes down to almost normal if these lifestyle changes are implemented. Okay, so that is when we advise on those lifestyle and dietary changes. No fried food, no skin of meat, eliminating or taking off any visible fats from your meat before you cook them. Okay. We equally look into what is called a familial hyperlipidemia. Familial hyperlipidemia. It basically means there are some people in their families, in their genes, they have this unexplained high lipids, high cholesterol, high LDL, high triglyceride. It is in their family, in the gene. We look into that. So if somebody has a familial hyperlipidemia, we get very concerned. They can be put on starting on a medication. Okay, we equally look into the person's family. If there's a family history of early onset of strokes or heart attacks, we do ask if either aunties, uncles, dads, moms have had an event such as stroke or heart attack before age 65, will get concerned. Obviously, the lower they are, the much more concern we get. If, for instance, I've had cases where somebody will tell me that his or her dad died at the age of 45, 55 of heart attack or stroke, we get very worried, we get concerned, because there is a trend towards that. There's an early onset of heart attacks or strokes. Then we look into if the person in question is diabetic, high blood pressure, if they've had an event themselves in the past, such as mini strokes, what's called TIA, transient ischemic attack, if they had what's called angina, chest pains, or heart attacks in the past. We put in that into context as well before we start treating. So it's a sequential thing. We just do it sequentially. We take one at a time. So yeah, mentioned to us that all these anyway are being done from age 40 when we do the health check thing, which I've mentioned to us in the past here severally. Yes, so it's not all the time that your cholesterol is raised that you be on medication. There are things your doctor, your healthcare provider, your nurse would ask you, and based on the findings, you may be advised on lifestyle changes, dietary changes, alcohol intake, smoking history, and so forth and so on. If that's a familial hyperlipidemia, we get very worried. If that's an early onset of heart attacks or strokes, we get very worried. If you're diabetic, hypertensive, or have other comorbidities, we get worried as well. Okay? All this will be looked into before you're put on medication. And yes, I hope I have answered your questions. Please take care of yourselves, your family members, your loved ones. Be safe and play safe. God bless. Bye.